Everyone has back problems. It's the most common reason why adults go see their doctor in the United States today. The Division of Spinal Surgery in the Neurosurgery Department here at Lenox Hill Hospital provides the best possible spine care. We have a clinical and a research arm to our division. Spine surgery today is incredibly safe. The new techniques, the way of reconstructing spines has completely revolutionized what we do in spine surgery. So the field has changed tremendously. We treat things like herniated discs, which can occur generally in a younger age group. The other huge group of patients that we see are the elderly. They have a completely different spectrum of spinal disorders. We have a host of procedures we can do. The major complaint they have is that the quality of their life has deteriorated. They're unable to shop, they're unable to go out with their friends, they're unable to be independent.
So what we usually offer for them is what we call a lumbar laminectomy, and all the pain symptomology usually goes away with an intervention like that.
I came to Dr. Levine for back surgery. I've had back problems since the 60s. A great deal of pain all the time, lower back, buttocks, thighs, everywhere. But it was becoming increasingly difficult to do everything. I just really decided that something had to give. So after a few consultations and a lot of thought, I decided to go ahead and have the surgery. He explained everything to me, and I knew what I had to do. I knew what I was facing post-op. He said the pain would go away, which it has almost completely. He said I'd be able to walk without a great deal of pain, and I can walk without pain now. I could get up and down without pain. I'm totally convinced that I made the right decision.
If you can do a relatively safe, relatively short hospital stay procedure on a patient who's disabled, whose life seems to be slipping away from him or her, and bring them back, it's incredibly gratifying. It's sort of like a fountain of youth to these patients. When I came on board here at North Shore, LIJ, I put together a laboratory because I knew that as an academic department, we needed to have a research component at the Feinstein Institute, which is run scientifically by Dr. Nadine Shaheen, and she has done an amazing job of creating a laboratory which has attained a stature within the field which is really unprecedented, looking at molecular mechanisms of inflammation.
Research is the way of how we change the future. Dr. Levine had this vision for building a spine research program to advance the field. The discoveries that we're making have the opportunity to reach and impact an enormous number of people. Trying, for example, to understand how stem cells can be used to help in disc repair. By driving that discovery field, we are in a position here to be the first group to implement new therapies and new care to the patients that may need it.
All of that knowledge helps me be a better spine surgeon. I think all of us are interested in pushing the frontiers of what we do.